Last month, Dr. Jerome Maruka was in our studio and showed us some simple exercises you can do to help improve your posture. Have you been implementing any of those in your daily routine? Remember, posture isn't just a physical thing. Bad posture can actually affect your health in so many ways. That is why this month we're going to continue with part 2 of Dr. Jerome's series of exercises to help improve your posture. So let me clear the floor and have Dr. Jerome join us now.
We're going to discuss achieving optimum posture, and this time we're going to focus primarily on the lower back. Now, in all cases, chiropractic care is absolutely necessary in order to progressively achieve an ideal posture. However, we're going to implement clinical exercises into this and show you some things that can implement directly with your chiropractic care in terms of maximizing short-term and long-term benefits. Now, we're going to bring Penny in. Now, in an earlier section, we focused mostly on the upper body, and this time we're still going to remind you of how the top affects the bottom, but primarily our correction is going to be focusing on bottom exercises this time. So as we review and we look at the abnormal posture on the upper body, this is called an upper cross syndrome. So if you'd ever want to learn more about it, if you just look on the internet in upper cross syndrome, you're going to find how the shoulders round forward, the anterior head carriage, the weakening of the muscles in the back, and the tightening of the muscles in the front. Now on the lower body, if this is happening in the upper body, the pelvic can be causing distortions as well, and vice versa. A pelvic that is off also can contribute to the top. So even though you may have worse symptoms in one or the other, you do not want to forget about the other. Even if you have pain and symptoms in your low back, you still want to consider the upper body, or if you have chronic neck and shoulder pain, you still want to look at the low back and how can this be contributing. Now we're going to take her out of this position because it's really uncomfortable for her, and we're going to review again what an ideal posture looks like. So you can palpate these areas on your body. We're going to just look at a skeleton only in a real life aspect, and if you palpate on the front of your hips, you're going to find a pointy bone. This is called the anterior sacroiliac. And on the back side, if you were standing in front of the mirror without any clothes on, you would have a little dimple on the back. And if you pushed on that, there'd be a little pointy, prominent bone there as well. If we touch both of these areas at the same time, ideally, these should be straight across from each other. And you're going to see many people, the one in the front is going to progressively get lower. And what that does is that tilts the pelvis forward, and it's not just about misalignments in your skeleton, putting stresses on your nervous system. The soft tissue is contributing to allowing this soft tissue or this postural abnormality to happen. So if we look at the pelvis tilting forward, the quadriceps get very short in order for this to happen. And this is an incredibly, incredibly important part of the correction process. So this muscle sequence of imbalances are incredibly important to dovetail into the chiropractic care you're receiving. Now, if the pelvis goes anterior, the abdominal muscles get stretched and they get longer. Again, if the pelvis shifts forward, the low back spinal erector muscles get shorter. And the hamstrings, even though you may have tight hamstrings, if that pelvis gets tilted anterior, the hamstrings actually lengthen. And this starts contributing to all those abnormal postural misalignments that we talked about in the front. So what can you do about this to help yourself achieve an optimum posture? And when you do that, so much pain, suffering, and symptom and weaknesses will go away, and absolutely the increased quality of life will be there when you feel so much stronger and confident and you don't have to worry about some of these things that have bothered you for so long. So we're going to use exercise balls, and we're going to have Penny explain and display to us how to stretch the quadriceps. Now this is a very effective way to do this. Now one important fact is you want to have a pad to kneel on that is an excellent high quality pad. So you do not want to kneel on your knee or you're really going to inflame that area. Now, just right here, you are going to get an incredible stretch if your quadriceps are very shortened by using this. Now there's going to be some variables we're going to talk to. Now you just want to be patient with this. You're going to be amazed in some cases how short your quadriceps are, and this can be pretty uncomfortable. So the smaller the ball that you use is going to apply for people with super short quadricep muscles, and then we're going to have larger balls to use for this stretching exercise. Now, if possible, you would like to have the heel touch the buttocks. And even once she gets to that position, now this is a little tight. Even though her pelvis was very good in a neutral position, you're also going to learn some things about in a functional position to where it's like, wow, she's even good in a neutral position, but when we ask her to do certain things, it's a little tight. Now, even if she was used to doing this, you can also further extend the correction by increasing this arm and gently leaning away from the area that we're stretching. And again, this is going to increase the fascial plane that we are stretching. Again, be patient with this. Even if you do a slight warm-up, walk around the block before you go in for your chiropractic appointment, or if you're going to be doing this stretch at home, warm up. Pain is bad. A gentle strain and stretch is good. Okay, so this should be not painful in any way, shape, or form. You're going to stretch both sides. So let's have you come on up, and we're going to start over on the other side and gently positioning. Good job. Now you can see even immediately in the camera where this side is easier for her. Much easier. She is able to come into this side, and these asymmetries also can play a part in your symptomatology. And think about, wow, these muscles on this side are so much more flexible than muscles on this side. Even in a neutral position, you may not realize this, but this here again can really uncover some of these imbalances you have. The quadriceps are the biggest muscles that we have in this imbalance pattern, so it's one of the most important muscles to address first. So good job. Come on up.
Like step up?
Yeah, just come on up here, please. And again, you can be using different heights of balls as the person progresses. Now, we're also going to do some other exercise. Chronic low back pain involves the pelvis in many instances. So this is the foundation to where your entire spine holds on to. And all these nerves hold that sacrum in place. So a very safe exercise for people with low back pain is you're going to step into this band with a slight amount of tension on the band. You're going to cross the band, and these are called X-band walks. So you're going to keep tension on the band. You're going to hold these up with the elbows tucked in, and you're going to take a side step. And then step the other side. So you are greatly going to feel the muscles that work that actually hold that sacrum and pelvis together. Many times there's significant weaknesses in both directions, or maybe more so just on one direction. This is going to help uncover certain imbalances and also strengthen that pelvis and strengthen that low back. That's going to affect your overall health and well-being as well here throughout. So these bands, again, there's different tensions. If you're not familiar with these, you can look at my website and get information on these, because you can't generally find these just in traditional rehab settings. One more thing we're going to use for low back care and for this corrective postural position, this is called core stretch, and this is such a simple tool. Stretching is difficult for many people. Let's actually just have you turn to the side. And so even when we have these certain tight areas and you ask people to stretch, they get all hunched over, and it's very difficult for them. So this has lots of different variables. We always want to start slow. And what this does is it increases the fascial plane of stretching. And we're just going to have you gently lean forward. And even if your low back is sore, you can have all sorts of muscle tension throughout the spine in numerous different places that does put stress and pressure on this area. So this is just a great way to increase flexibility throughout your entire body. We have people that are 50 years old in the clinic, and they have never come within 12 inches of touching their toes. And just within weeks, they can progress to making these significant improvements. So this tool not only helps low back flexibility, you can see how it also is going to play an important role in shoulder flexibility. And relax. So just implementing some of these very simple, safe stretches and strengthening exercises that we showed you today, this will absolutely help improve your recovery and maximize your posture through a lifetime of quality.